Hello, this is Jackie again. I'm here to further our discussion about trigger points and dry needling. So what is dry needling? Dry needling is when a therapist will use a fine, solid needle, similar to an acupuncture needle, to access the trigger point. And that trigger point is either in the muscle or the attachments, or it may be in a scar. So what will happen is that your therapist will first of all explain what dry needling is and the dangers and the benefits, and then they will clean your skin, use the needle, which is a once only use needle, and wearing gloves, they will you'll feel maybe a tiny needle prick as the needle goes through the skin. And then when it does arrive at the trigger point, you'll definitely feel it. And you may feel one of three things. It could be that you feel the muscle twitch, which is quite a surprise sometimes. It's an involuntary muscle contraction, and it means that the needle has arrived at the taut band, and that twitch is a response of the trigger point to the access of the needle into that area. You often will feel a familiar pain, the pain that has been coming from the trigger point, and very often that pain can be referred to a different area, and that also means that your therapist has been accurate with the needle to find the right spot to get a good effect with the needle. So what does the training therapists go through to learn how to do dry needling? First of all, they come to their courses, which are usually after they've already qualified as physical therapists with most of the knowledge they need to know to be safe doing the technique. And the biggest part of that is that they know their anatomy in the areas very well. So they know where the blood vessels are, where the nerves are, and they can always be cautious when they are around the thorax, where if a needle is wrongly used, it could cause some damage. So their knowledge of anatomy makes them already very well qualified to learn it. They also are very good with their hands, and so that knowledge of how to find the muscle and localize the tight band within the muscle is very important to being able to localize it for the dry needling technique. So the needle will arrive, and you'll feel one of those things, and the therapist will probably move the needle within the muscle a little bit until the twitches are gone and some of that referred pain is easing away, and the feeling from the therapist will be that the muscle will soften and it's ready and it's finished. And this takes literally a few seconds. Sometimes the needle is left in place and a small handheld e-stim unit might be used to make the muscle contract and to teach it how to retrain and pull all together again to help with that retraining, which is very important. The therapist then takes the needle out, and that part of the treatment is finished. Needling should never be the only thing your therapist does, and it's really just a part of the whole procedure. So you may ask, are there dangers involved with dry needling? Well, you can probably imply from what I've already discussed that there could be. So you could have a small bleed happen, and that is usually very minor, and it would be stopped easily with a bit of cotton wool. And that could cause a tiny bruise, but it's rare to happen because of the fact that the needles are so fine compared with a hypodermic needle. The pain is also less than it might be with a large needle because of that fineness of the needle, but there may be some pain afterwards because the muscle is learning to normalize, and that is an insult into that area of the muscle, and that may take a few hours to a day or two to resolve completely. The other danger, which is a big danger, but very, very rarely has ever happened, is that if the therapist is needling over the thorax, if they did the wrong thing, such as use a needle that's too long or in the wrong way, they could puncture your lung. But it happens so rarely that it's a very, very minor risk, and much more minor than it is the risk of other things in medicine. So the risks are low and the benefits are high. You might be asking me, is it the same as acupuncture then? Because it must use a similar needle. It's actually very different from acupuncture. The reason why we call it dry needling is because originally it was done with medication. So doctors most of the doctors that were doing it were doctors that were doing research here in America, and they were using either a local anesthetic, a steroid, or a combination of both to inject into those nodules and tight bands that they had found. And they were having very good effect. And the same doctors that had done most of the research into it also started to experiment with using no medication but the same needle, and they found that the effect was as good. And so the medication wasn't what was causing the effect, it was actually the effect of the needle. And so, as you can see, it's quite different from acupuncture, which is using similar needles, but really acupuncture is a whole system of Eastern medicine, which is fabulous and very effective, but very different from actually dry needling, which is what physical therapists practice. Conventionally, therapists have always treated trigger points, and often we have used various techniques like deep tissue work, some strain counter-strain, cross frictions. All of these techniques can effectively resolve some trigger points. But the dry needling can be faster and more effective in a shorter length of time because of several reasons. First of all, it is very accurate. It will get to the depth of the trigger point in cases especially where the muscle's quite deep. You can use the right size needle to get there, and the twitch response has multiple effects. First of all, the twitch is a very maximal contraction, which then allows the muscle to deeply relax. And when that happens, the blood supply can flush into the muscle and bring the oxygen that the muscle needs to function properly. And also, at the same time, flush out all the toxins which have been building over time in that area and causing a lot of your pain. The other side effect of needling is that the brain has a response to the needle prick effect by releasing its own natural opioids. And when that happens, then you do get some very deep pain relief happening, and that also can flood your system with your good adrenalines and help to really resolve your pain over time. Those opioids are very effective and very strong, so sometimes they can end up making you feel sleepy, like when you take some strong pain relief medicines. So you may be asking, well, I can just ask for that magic needle and I'll be better. So I must tell you that dry needling is only a very small part of your treatment that you'll have with your therapist. So your therapist, during the course of your treatment, will teach you how to stretch and often give that muscle its normal stretch gently and teach you that exercise to do while the muscle is healing and the trigger point is resolving. And the therapist will also teach you exercises that will teach you to recruit the muscle back again so that you learn to use it and the function is restored. The other things that are very important is that often trigger points are not the only problem here, and it may be necessary to do joint work to restore the range of motion in joints, which is very important. And certainly your therapist is going to teach you how to avoid the bad habits which may have caused the trigger point to form in the first place. And finally, the most important thing is to teach you how to be completely healed and prevent a recurrence of the problem that you've just had. So that complete treatment should be available to you as the therapist feels appropriate.